Hey guys, it's Dr. Emer in West Hollywood, and now we're going to do some hair injection treatments. This has been very popular over the past few years because there really wasn't anything non-invasive for many years to really help hair rebuild its strength, help thicken or darken the hair, or reverse falling. How I see this is a preventative treatment. Everyone that's destined genetically to lose their hair is going to lose their hair. But if you start these treatments early, you're going to lose this at a slower rate or help rebuild some of the hairs that are thinning. Our patient here today has the typical male pattern, a little bit of thinning in the hairline, in the temporal and frontal hairline, and then the vertex crown part of his scalp, he has thinning. Two options here. One is to start transplantation, taking a little bit from the donor sites and implanting here. I think that's a great idea for him. But regardless, you can't go run a marathon without training for it. So we're going to start with PRP and stem cell injections to the scalp to get that fertilizer into the scalp to make it grow, to make it thicken and strengthen even before we decide to do transplant. Now, if you don't want to do transplant, you can do these injections, but the expectation is a third of the patients will improve dramatically. A third of the patients will stop the loss. A third of the patients will continue to lose. And that's not an effect of the injection, it's the effect of your genetics. So blame your parents, okay? So we're going to start today. Now, obviously, there's other things like Rogaine, Propecia pills, other topical things like Restore C Scalp, and oral vitamins called Viviscal that also help. So you want to do everything you can with your internal nutrition to also help hair loss. And again, if you have stress and a lot of other issues traumatically medical in your body, you may also lose hair, and that's called telogen loss, and a lot of people have a combination of both. So it may not be the PRP that's not working, it could be there's other things going on, hormone stress, etc. So we're going to start in the back. You're going to feel a little pinch on the count of 3. 1, 2, 3, little pinch. I know it's not the best feeling in the world, but it's just a few. He's doing great. Now, in the past, we used to do a little pinch. We used to do a bunch of numbing. The problem is the numbing, especially with nerve blocks, causes the scalp to get very swollen. Okay, that's almost there. Only a few more to go. You're doing great. Deep breaths, okay? And it causes a lot of swelling. I like people to walk out of here very quickly like nothing was done. The other thing is, we used to do air cooling and rolling and stuff on the scalp, and it just caused a lot of issues. We just tell people little pinches. We have SEMA rubbing people's arms and shoulders. It helps make them think about this a little bit less. Perfect, good, halfway done. And you can see here inside the PRP what I call the snow globe effect. You can see the little stem cells inside called Acell. And the studies have shown, even though it's not necessarily approved for this, there's a lot of studies that have shown much more improvement with the PRP when you have the Acell. So yes, it's a little more expense, but it's a better result. And we spared no expense, and we're trying to give really good results to the patients. Pinches, you're almost there, doing fantastic.
Can you explain to the viewers what's on his face?
Yeah, so if you didn't see our previous post, he's getting the full treatment today, the full spa experience. He's also getting a lightening peel, almost done, a lightening peel to help his discoloration, and that's called a Cosmetic peel. We also have one that's a little less strong called Enlighten that you can purchase online through us, and we do a virtual consultation to help you apply it. That will also lighten your skin. So if you have acne marks, pigmentation, last one, acne marks or pigmentation issues, scars, burns, etc., that would really help. He's a darker skin type. That little pinch here, sorry, that's the one that hurts the most. He's a darker skin type that has genetic pigmentation and also sun-related. Last one. Good. All done. And that we're going to get him clear. We want to prepare him to look good for upcoming events that he has in his life. So that is PRP with Acell injections to the scalp. And the majority of people have minimal pain. He's a more sensitive teddy bear, but we've got him taken care of. He did great. and he's going to start to see some regrowth in the next 4 to 6 weeks and less shedding of the hair. We're going to continue these treatments once a month for 6 months, and then every 2 to 3 months as maintenance forever. Bye, guys.